Hey guys, I'm Lily, and today I'll be talking about pharmaceutical pricing in America. Imagine you just graduate from college and you're starting a new life with your significant other. A few months go by and you're now expecting a baby. Another 9 months go by and you now have a healthy baby girl. Life is going great until you realize your little one is diagnosed with diabetes at only the age of 7. As if this already isn't hard enough, explain to your little girl how she will have to have an insulin pump attached to her body for the rest of her life. You now have to figure out how you afford this medication vital to her livelihood. I know most people are just assuming that insurance will cover the cost of insulin. However, what many people don't realize is that a lot of time your copay won't even cover the annual cost, leaving you paying up to $600 a month for just a bottle of insulin. This story doesn't apply to just diabetics, but anyone seeking medical care. Healthcare is a very complex topic, but the key issue of this story is prescription pricing comparative to other countries. How is this an issue and why hasn't it been resolved yet? Next, I will be going into a little more depth about what has been going on the past few years in America and some possible solutions to the issue at hand. As previously mentioned, one of the largest problems of the world of pharmaceuticals is how much people are charged for their prescriptions. A few reasons this is such a detrimental problem include the simple fact people can't afford medication that could ultimately save their lives, and companies are profiting off of these price increases. In an article posted on the ProClinical website, HIV preventative drug Truvada was recorded to cost $2,000 a month compared to $58 in the UK. Companies profit off of this by their manipulation of supply and demand. Pharmaceutical drug companies in America work off the free market theory that our country has in place. This gives these companies the ability to charge basically whatever they feel because they are unregulated by the government. Because of this, America has the highest drug prices in the world, according to Vox. My solution is to implement what many countries already have by using the International Pricing Index proposed by the Department of Health and Human Services. This would set certain drug prices based on international benchmarks. Many countries, like the UK, Spain, and Ireland, already have government agencies set in to make these decisions on drug prices. The United States is one of the few places where drug makers have the right to set their own prices. Now, many people argue that this idea goes back on our free market world, but there's a fine line between morality, monopoly, and freedom of enterprise. These companies are profiting solely off of human misery. With this price index in place, the government would not only force transparency from these manufacturers to disclose the actual price of these drugs, but also be able to regulate the effectiveness of drugs being put on the market. If reform to the pharmaceutical world is not changed, drug prices will continually to be marketed freely. Insurance is not even a logical debate to bring up, as many times copays don't cover the entire cost, and those suffering with chronic illnesses such as HIV, ALS, are forced to pay more and more. As for the citizens making a change in this issue, the first step is to educate yourself. This is something that affects each and every one of us, even if we don't realize it yet. This shouldn't even be a political debate, and yet it is. Not to get confused with the free insurance frenzy that has encompassed our upcoming election, this is simply just asking drug companies to disclose their expenditures and profits to better assess fair pharmaceutical prices. Voting for these changes is the next step to reform. Every election matters and every vote counts. Being in our late teen years to our early 20s, I know this isn't something that we think of often, but most of us are probably still on our parents' insurance plans to begin with. But I urge everyone to think of our futures, our kids, and our parents. As 40% of the population are affected by chronic illnesses, and that is not to mention every other prescription that we will need in a lifetime. Thank you.